Hello, everyone. Hello. We are live. Hello, my name is Stacy Nell. I am the Executive Director of the Kansas African American Affairs Commission. And I want to welcome everyone to our Lunch and Learn today. I was not here last week because I was on vacation. I was on vacation in Orlando, Florida. We went to Universal Studios. It was much fun. But today I am thrilled to be joined by Dr. Lynnette Sparkman-Barnes. Hello, Dr. Sparkman-Barnes.
Hello, Executive Director Now. How are you?
Good, good. Thank you for joining us today.
All right.
We only have a half an hour, and I have
Okay.
found that that half an hour speeds by.
I know it.
And I'm usually just firing questions at you as fast as possible. But
Okay.
I do want to let everyone know who you are. Lynette, I'm going to read your bio. Everyone loves
Okay.
when I read their bio. But Lynnette Sparkman-Barnes is a clinical psychologist and multicultural specialist for the University of Kansas Medical Center. Previously, she served as a psychologist and associate director of counseling services at UMKC. She has also worked in community mental health through developing school based mental health programs across several Kansas City school districts and within the juvenile justice system. Through her work, Sparkman Barnes has actively promoted diversity, equity, and inclusion within healthcare, education, and ministry. She has presented both nationally and internationally on issues of diversity and its interface with mental health and theology. Sparkman Barnes grew up in Wyandotte County and has sustained her commitment to the community by working directly with the community, serving on agencies, boards, working with local school districts, and striving to empower others within Wyandotte County and the greater Kansas City area. She's an ordained minister within the AME Church, together with her husband and pastors a congregation in Wyandotte County. And she currently lives in Wyandotte County. So KCK, repping it.
KCK. Yes, the dot. Yes.
I graduated from high school in KCK, so I always have
You
to,
did. Which one?
Sumner.
So did
And
I. Yes. Yes. Come on, Sumner alum. Yes.
where'd you graduate from?
Sumner.
Yeah, what year?
88. I'll age myself. Yes,
Oh, see,
88.
because we were there at the same time because I came out in 90.
Really? Oh, oh my gosh. Okay. I have to go back to the yearbook
I'm gonna have to dig out my yearbooks.
Yes.
Okay.
Yes.
So I'm just not
All
that
right. So
far
we were
behind you.
there. We were there together. Yes.
Okay, so the first question I always ask everybody, since this is a lunch and learn, what are you having for lunch?
Oh, great. That's a great question. I don't get lunch until like later this afternoon, probably 3.
Oh
So,
my.
yeah, yeah. Mondays are my super long days, kind of like 12s I do on Monday. And so I'll probably have like maybe some falafel and a little Greek salad or something like
Well,
that.
then
And
I feel ever even more special that you took some time out of your busy Monday to chit chat with
absolutely.
me. Okay, so I met you because we were on a panel together with
Mhm.
the Kansas Birth Equity Network, and so
Yes.
I sat next to you on the panel, and every time you would talk, I would think I don't want to talk after her because I'm just
Ah,
listening to her. So I wanted to bring you on to talk specifically about your work with mental health.
yeah.
I know in our community, mental health, honestly, in the general population, there's oftentimes a stigma in talking about mental health,
Mhm.
but even more so in our community, in the Black community, having
Yeah.
a stigma of talking about mental health.
Mhm.
So I was intrigued, and I really wanted to have you come on to talk about your work because you say you're a clinical psychologist, and you do see patients.
Yes, absolutely.
Hmm.
Yes,
So
I'm
now
a
you
clinician at heart.
a clinician. Okay, so you work directly with students and residents at KU Med.
Yes,
So,
yes.
like, what does your day look like, or when you see patients, what does that entail?
Sure, absolutely. Well, I'll see up to maybe 6 people a day. On long days like today, I usually have a group that I do as well toward the end of the day. And so, just to kind of give you a little background of our office, counseling and educational support services, and there are 5 licensed clinical psychologists, and we have 2 postdocs, and a practicum student. And we're about to make a shift in our trainees right now, actually. And so, um, an office of 5 is actually a pretty small office, but we treat 26, 27% of the population there
Really?
of students and residents at KU Med. So we see a lot of students and residents.
That is a lot.
Absolutely, absolutely. We see them, on site as well as virtually. COVID taught us that telehealth really does work, and we can do that very well. Um, and generally, people come in, top, top reason people come in is stress and burnout. We're at a health science campus, and so a lot of it, of course, has to do with their academic programs and their workloads. Um, you know, so we see med students, nursing students, PT, OT, speech language pathology, PhD students, you know, all the health sciences, as well as the residents who, of course, are working, 80-hour week schedules, things like
Hmm.
that. So it's
Hmm.
tough. So stress and burnout is absolutely number one, followed by anxiety. Then we get depression. Also up in that top five are, drug and alcohol concerns. Um, Definitely up there. And then, relationship issues. Um, it is a predominantly white institution, and so overwhelmingly, the folks we see are, white students and residents. And so, in my role there as multicultural specialist, I am there to do a few things. First, I mean, and this has been throughout my practice. I have devoted my practice to working with underserved populations, and so that's basically my community. I love, working with Black folks in all communities of color, as well as people who would be like first generation, students, not just with undergrad, but with these graduate studies, these professional studies as well. Those who come from lower socioeconomic backgrounds, where money has prohibited a lot of things. Those from the LGBTQ community, and those of different faiths,
Hmm.
those, of different faith systems. And so then in my work, I do treat, the students of color that are there, and everyone in the office does, but often people will want to come and see me because they know that that is my background and that that is my area. Multiculturalism is my area. And so then the students of color will often come to me, or, to others there in the office, and um, with feelings of isolation, a lack of belonging, significant, uh, I guess, and we're fond of saying microaggressions now, but I'm just going to say, you know, working within oppressive systems,
Hmm.
and trying to figure out how to navigate that when they are, invalidated on a regular basis, not seeing themselves, of course, in their fields, but, in their curriculum, only being seen in their curriculum when it's about a specific disease or something like that. Of course, hearing from their peers as well as from faculty too, some pretty, um, denigrating things at times, based upon stereotypes and how oppressive a system medicine has been.
Right.
Anyway, still hearing things like, oh, well, Black women don't feel pain. I guess we're not like any other person, and
I don't know. I know I feel
Right.
pain. I've stubbed my toe and screamed a couple times.
Totally, totally, totally. Yes. And so that's what they're experiencing. And then when, you're matriculating, of course, at a PWI, predominantly white institution, you don't have a lot of people that look like you. You don't have a lot of faculty that look like you. So you don't have a lot of people to mentor you as well. And you feel pretty alone in those situations. And you're asking yourself, hey, did that person say that because, I'm a person of color, or am I just like this horrible student? You
Mm.
know, and so um, that's a lot of what I
Yeah.
get, and I do a group, and with my postdoc, my multicultural postdoc, we do a group called the Women of Color group, and just it's a space unlike any other space where women of color from all, the health sciences program can come together and process everything that's going on in their lives and look at it from this lens of who we are as women of color. And so yes, when somebody, says something to us about, hey, you need to pull your hair back because it's too big, you don't say that to other people. You're saying that specifically about me and about my hair texture and things like that. And what does that mean for me? And where do I have a voice here? The power differential is so real. Can I say something? If I do say
Right.
something, is that going to, somehow curtail my career or something like that? So those are the things that we talk about, that we really get into. So race-based experience, race-based trauma is something that's very real. And I'm so blessed that I'm able to work with the students on that.
So, wow. Okay. So you've said a lot. So
I
you
know,
see,
I'm sorry.
I was like, I
I
can't
get
do
so
it.
excited
I've
for
made
more.
like 3 pins and everything you said because I
Yeah.
want to come back and like
Okay.
talk to it. Um, uh, we'll get into the issues in just a second, and then like the different types of things that you're seeing.
Mhm.
I wanted to back all the way up to one of the first things you said, because you said telehealth,
Ah,
telemedicine. So, I wanted to sort of point out, how has the pandemic shifted? And you said it, that the pandemic has shifted towards telehealth. So
right.
that is definitely an avenue that people can have
Mhm.
to access care.
Mhm. Yes, yes, absolutely. And it's kind of a double-edged sword, because of course, I think it very much helps when people are in the room, in the
Yeah.
same room, with their provider, especially when it's talking about mental health, behavioral health. The thing, though, is that of course in our office we're still masked, and so much of our work really is dependent on what we can ascertain through nonverbal cues and
Right.
facial expressions and things like that, because people will say a particular thing, but their
Hmm.
faces and their affect is completely different. And it's so
Hmm.
very important for us to see that, so that we can inquire about that and further assess that. And so that's what masking takes away from. Okay, so in person right now is a bit of a challenge because of that. However, we're still able to develop and foster that relationship, even if we cannot see the face. So some opt for continuing with, Zoom or whatever telehealth medium we're using. And so much of that has been the convenience of it. It
Right.
has really opened up this world so that people that historically have been excluded from participating in, regular mental health services, because I, really can't get to that
Hmm.
place. I can't get to the office, or, I can't afford to travel out to your office. The office is too far from me. The office isn't accessible. Think about people with disabilities, and so
Right.
many offices are not even accessible, ADA
Have
accessible.
you seen an increase in patients because of the availability of telehealth?
Yes,
Oh, okay.
definitely. I think, first of all, we saw an increase of patients because of COVID and the
Hmm.
stressors that caused.
I was going to ask about
Yes,
that. Yeah.
absolutely. From the fears and anxieties about it. And of course, being at a health science institution, we are working with several people that would be called frontline workers,
Hmm.
because they, are direct patient facing in the hospitals. And so a lot of fears and anxieties about that. And of course, a lot of fears and anxiety just about the world in general, as people were like, oh my gosh, I'm afraid to go out. I'm going to catch it. I'm going to die. A lot of grief because, we did lose a lot of people.
Yeah.
And people lost family and friends, and it was a very hard time. A lot of confusion and stress in learning how to, with um, kind of the social isolation of it, not being able to be around people all the time, being at home and being with people in their lives that might not have necessarily been healthy people either.
Mm.
A lot of things, a lot of negative things increased during COVID as well. Say, for example, domestic violence and things like that.
So you would say, I mean, because, not working in the mental health field and not working
Hmm.
in the medical field, so I'm completely like an outsider. I would
Hmm.
always feel like I would hear competing reports in terms of how people were doing during COVID, right?
Yeah, yeah.
Sometimes, and uh, and coming and moving through. And I should say, are we even out of it? I'm not even sure if we're fully out of it.
No, I don't think so.
So the lingering effects, like, so how are people, how do I ask this question? if people are feeling lingering effects from COVID,
Hmm. Hmm.
do you have any, I'm not asking you to do like a therapy session
No,
here, but
no.
do you have any pieces of advice, or if how does one know if what they're feeling is something that warrants seeking treatment? There we go.
Sure, sure. Okay. Well, first, I'm going to say the lingering effects of COVID are real. Okay, I just like to normalize that for people. We are not out of it, even though thankfully we are seeing the numbers of deaths, decreasing or plateauing or something like that. Thankfully, of course,
Mhm.
one death is still too many
Yeah.
deaths. Okay. Um, with Omicron and all the other spin-offs
Yeah.
we have, folks, hopefully folks are not as sick as they were. They are not as symptomatic as before, but we are in no ways out of this. Still around me, people are still getting COVID. People are still symptomatic with COVID, from the church to the people, there at the hospital and at work, to people here in my community, neighbors and things like this.
Hmm.
It seems like every 2 weeks somebody else has COVID.
Hmm.
They are symptomatic. All right. So it is very well. If you are still feeling something about it, that's because we are still under this. This is still happening, and our lives have forever been changed. And I think that's one thing that people find very hard to grasp. Our lives are forever changed in this society where we talk about getting back to normal.
Right.
Yeah, I'm not sure what normal
We'll
is.
never get back to that normal.
Right. And
Yeah.
and I want people to understand that. And I know some people are calling it a new normal. I'm just saying that we really are living our lives in a different way. And that's not necessarily a bad thing. You know, for some people, it is so drastically different that they are still trying to adjust to it. For others, it was a very positive experience for them, and they were able to. Oh my goodness, all of the web. Um, Job opportunities
Mhm.
and the new endeavors and entrepreneurial things people started in, how ministry started to flourish and people started tuning into faith services from all over the United States and all over the world. These are very positive things that we got out of it. Plus, I think just knowing that we are resilient and that we were able to do this.
Yeah.
Of course, this does not stop us. We are going to survive, and we're going to not just survive, but we're going to thrive.
We
And
survived the
that's
plague.
yeah, we have survived. Hey, we have survived atrocities.
Yeah.
Okay, and so not only are we going to survive, we're going to thrive. Okay. We're going to do this because that's what we do. That's what we do as humans. We take something and it's just like, I may not like it, but doggone it, I'm going to make it work and I'm going to make it work for me. And that's what we're doing. That's what
So, but if someone is still feeling anxious or
Yeah,
depressed, like
absolutely.
at what point, like where, like, are there any markers that people can sort of maybe do a self-assessment? So it's not just
Hmm.
because everyone has bad days.
Yeah.
Yeah,
Yeah.
you can wake up and just be like, okay, I'm having a bad day, right?
Hmm.
I burned my toast, I spilled the coffee, the dog peed on the floor, and that's just a bad day, right?
Yikes. Yeah.
But how do we know the difference between I'm having a bad day and I should
Hmm.
I should seek treatment?
I should seek treatment. Yes. Well, I think that you have to look at, telltale signs. Certainly, if your sleep has been disrupted since all of this started and it continues to be disrupted, then you might need to seek some help about that, because that's probably a sign of, maybe you're still very anxious, or, there's something on your mind that you need to really talk about. If you find yourself feeling depressed more times than not, if your weight is, fluctuating because you find yourself, hey, they said people gained the COVID-19.
Yeah.
Okay. Right. Or if you've lost a lot of weight and you weren't trying to do that, just kind of in a very unhealthy manner, then those are signs that you might want to seek help. If you feel that you are just very disconnected from people and you don't know how to connect to them, you don't even feel good in connecting to them, then
Hmm.
definitely seek some help. If you find yourself being very anxious, and that's what definitely skyrocketed during COVID was anxieties. And there was good reason to be anxious
Yeah.
about things. um, then you might want to seek help. I do encourage people to, again, limit the social media, limit the news you take in news from credible sources that you can hear just kind of all sides of a story, because we tend to, want to take in things that are very one sided, and we just kind of snowball.
Hmm.
When we're like, oh, the world is burning, then we gravitate toward news to tell us the world is
I
burning.
think the world is burning though. I will know, but I
Well,
understand that
literally,
because
not
for
literally,
myself, yeah,
global warming.
literally.
Yeah, yeah.
For myself, it's like I cannot pay attention to national level politics
Hmm. Hmm.
because I'm like, that's just too much. People say, well, and I'm like, I don't even know. Like I'm state level. I pay
Yeah,
attention to state level politics.
yeah. I mean,
And
and I
there are
even
days
had
when
to
that's
scale it.
overwhelming. I can
I
barely pay attention to local level politics. I'm
I
like,
know I had to scale it down to local. I was like, okay, redistricting in Wyandotte County. Let's tackle that.
I
Let's,
got my lane. I got my
yeah,
lane and I
yeah.
stay in my lane.
And that is okay. It's, because things do seem so big, and it makes us even more anxious because it's so big. And so when we can narrow it down, but not hyper focus in our narrowness either.
Yeah.
Yeah.
So now I know you mentioned that you deal with students of color,
Yeah.
and marginalized or underrepresented
Hmm.
populations, which can mean a whole lot.
A whole
Do
lot.
you think, do you see that these things might present themselves differently in certain populations,
Hmm.
or like the anxiety or depression, does it potentially present differently in a Hispanic population or Black population or LGBTQ population?
Yeah, yeah. I mean, in many ways, things are quite similar, and I'll ask, similar questions as far as the sleeping and eating, drug and alcohol use, things like that, or just the anxious feeling, or if you've started, more compulsive types of things, is, washing your hands compulsively, things like
Hmm.
that. So I'll ask similar questions, but sometimes people do present a little different, and they'll present saying, well, my stomach's been bothering me a whole lot, or I just keep getting these headaches. And yes, there could be some things going on, and especially at a health science institution, I think we kind of like jump to the we'll get the full workup and things like that.
Never Google your symptoms, right? It's
Oh
always
my,
going to be
it
cancer.
always ends in cancer for some
Yeah, it's
reason.
just
I don't understand that. Uh, but when people present with that, then I know to kind of step back. Okay, well, let's talk about when this started. When did you first notice this? When does the stomach ache happen? When does the headache happen? And then you can start, kind of like peeling those layers back, to see. Okay, it started happening here. Did you change anything else? Has someone come or gone in your life? Have there been any losses? Things like that. I think also sometimes folks will come and their anxiety is very much tied to the people that are around them, more collective types of cultures and more collective types of way of doing family.
mm,
And it's like, okay, I do have a lot of anxiety tied because I'm doing school and I have to help take care of A, B,
mhm.
and C in my household, or something like that. And so sometimes it can just look a little bit different as well.
Yeah.
Hmm. Yeah.
Yeah. And I wanted to ask, because I'm going to reveal my own stereotype because I put it even in our agenda that I sent out. Like, are, do men, do men find it harder to seek treatment than women, especially in the Black community? Because I know, sometimes there's, and it is, I'm going to admit it's a stereotype. So please
Yeah.
correct me and say, no, Stacy, that's wrong and stupid. Don't ever repeat it. But do you think that men have a more difficulty seeking treatment, or how would you encourage men to seek treatment?
Yeah, no, actually, that's true. It's not a stereotype. Women do tend to seek treatment more readily. Often, when men seek treatment, it's at the kind of the pushing of someone else in their lives, saying, "Hey, I think you should, seek treatment." And then, especially when we're talking about communities of color and we're talking about Black folks, we can just talk about Black folks for a minute.
Yeah.
It's just such a stigma. There is just such a stigma, and so men, women, it's hard for Black folks in general to say, I need help. We've kind of grown up with, number one, what happens in this house stays in this house. Okay. And so you're not going to tell your business to somebody else. Number two, oh, well, that's just his nerves, or yeah, they're just like that. It's going to be okay. Pray about it,
Pray
lay
about it.
it at
Yeah.
the altar, things like that. And I'm a minister. I'm all for praying. I'm all for praying. And also, I know that God sent mental health professionals here and gave us the knowledge and wisdom
Yeah.
to help people, because it is very real.
I'm glad you touched on that, because I think even in my church community, there's been, and it's been slow to come,
Mhm,
but just more of an acceptance that yes, there's a place for prayer.
mhm, mhm.
Yes, obviously, from my faith community, this idea of God being in control, but that could be one of those little, what are they called, like platitudes? Oh well, God's in control.
Yeah, yeah, because people don't know what to do or what to say.
So, but yeah, say it again, coming from the place of an ordained minister and
Yes, absolutely.
psychological professional, that
Yes.
yes,
God
you
has
can
placed
pray,
psychological professionals in our lives
but the
for
Lord
a
has given
reason.
us medication also.
Absolutely, absolutely. And I said, if somebody did say cancer, yes, some people will say pray about it, but I think for the most part, people are going to say, okay, do the treatment you need, the chemotherapy, the radiation, do the treatment you need. What a lot of people don't understand are mental disorders are biological basis as well. Sometimes it is situationally specific, but for the most part, it is a biological basis, which is why, when we have Uncle so and so who really just kind of lied around and had the curtains drawn all the time, but we didn't call it depression, but it was depression.
Hmm.
Okay. Uncle so and so wasn't the first one in the family to do that. He probably had an uncle and aunt or parent that did that. And Uncle so and so is not the last one. There's probably someone in your family that's very similar. And so we need to start calling it what it is and not just kind of excusing it away or acting like it's not happening.
Right, right.
And
So
so
that,
that's heredity too.
yeah, because a lot of times they
Mhm.
do run in families.
Yep. Yeah.
Okay, so definitely, in our community, in the Black community, there's a stigma just around seeking
Hmm.
mental health,
Yeah.
one, and then with the added layer of potentially, if a person could be benefited by having medication, that
Yeah.
doesn't mean that you're not faithful. It doesn't mean that
Right.
you're not,
No.
that like somehow you failed. It just means that there's ways that actually can make us feel better and make us feel
Absolutely. We have
better
medication.
than
If you
screaming
have
out
a
in pain.
headache, you're going to take Tylenol.
Yeah.
It is the same thing. If you have allergies and you're sneezing, you're going to probably pop a Benadryl.
Right. Yeah.
Okay. You're going to want to somehow have relief for your symptoms, and you found that through medication. And
Yeah.
so the psychological disorders, yes, medication management can be extremely helpful for that as well. It's the same thing, but people, we just want to separate it,
Right.
for some reason.
Well,
Yeah.
I definitely want to get to that point.
Mhm.
Okay, so now you say, so are there? I'm trying to look through my notes. We've sort of skipped around in my notes, but I want to make sure I covered
All
all the questions I wanted to make sure I wanted to ask.
right.
You, in your work at KU Med Center, do you have any like workshops coming up or anything that you want to promote or tell people about?
Oh my goodness gracious. You know what? I'm going to send you a link, and because we all, through our diversity, equity, inclusion office with our vice chancellor, there are always some great things coming up regarding that, as well as our international programs office. There are always some great things coming up with that. But I just encourage folks, of course, you can always go to the website and take a look at us. I do a lot of workshops like for departments and things like that.
Oh,
That are,
okay.
just more
More
kind of
internal
private.
workshops.
Yeah. Mhm. Yeah.
Gotcha.
Yeah.
Gotcha. You have to be in the know.
Right. Yeah.
I understand.
Yeah.
See, and that's why this half an hour, we have like a minute and a half left in the half an hour. It just flies by.
I know.
We just jam in all the information. I do always reserve a couple of, oh, someone has just put something in the chat CHW, as I'm going to go with community health worker. As a
Okay.
community health worker with KUMC, I would love to know of more of the workshops. So do you have like, is there, when you, like, it's because she's at KU Med.
KU. Okay.
So it
All
would be
righty.
something more internal.
Yes.
Um,
Yes. Let
on your
me.
screen, Dr. Sparkman-Barnes, if you go up to the right corner, it says comments.
Uh-huh.
Do you see that?
Okay. see. Yes. Oh, okay, there they go. There they
Mhm.
go. Okay, I was just like, I don't see it. Got it.
So if you have a link or something that we could just drop
Uh-huh.
in the comments right now.
Yes, that's what I'm trying to get right now. Here we go. Actually, we're just gonna do it this way. I'm coming, y'all. I'm coming, you all. Oh goodness, and this is when it wants to stick.
I know it always
Right?
technology.
Absolutely.
When it works, it's fantastic, and when it doesn't, it's just.
Right. I
It's like, how
am
did we survive without this technology?
right. I am going to drop just the website for the Office of Diversity, Equity, and Inclusion, and you are free to go on there. Okay, how do can I put it in the chat?
Under comments and post post a comment down towards the bottom. I think
Down
it's
towards the bottom. Let me see. That is not giving me that. Let me see. I put it in the chat. I don't see.
I see where you did it.
You got it?
You got it. I got it. I
Okay.
got it.
Okay. Thank you.
Okay. There we go. Miss
All right.
Leslie Ann, I have dropped in the chat the link to the diversity, equity, inclusion page.
Mm-hmm.
And then I just briefly at the end of every lunch and learn, I always want to make a play and a call for people to make sure that they're registered to vote.
Yes.
So Sierra might be dropping in those links. We just had a special election this past week. That went well, but don't think that you're done voting because now we have a general election coming up on November 3rd. It's a Tuesday, so you can continue to, if you're not registered to vote, register to vote quickly, because if you just turned 18 or something like that, if you know someone who just turned 18, please make sure they're registered to vote so they can vote in the upcoming general election. There will be a lot on the ballot, everything from the United States House of Representatives will be on the ballot.
Mm-hmm.
One of the Senate seats is on the United States Senate seats is on the ballot.
Yeah.
Governor, Lieutenant Governor, Kansas Attorney General, Kansas Secretary of State. Let's see. All of the Kansas House of Representatives. So the Kansas Senate is not up. They're not up till later. So we've just dropped in where you can look up voter information on the Kansas Secretary of State page. Please make sure you're registered to vote. Please continue to make sure we vote. The voter turnout for the election on August 2nd was really high for a primary election. So good job, Kansas.
Good. Yeah.
Keep it up. Make sure you turn out to vote in November. All right. Look at that. We're at 32 minutes.
All right.
This half an hour just speeds by. So thank you so much, Dr. Sparkman-Barnes.
Thank you. Thank you for having me, Executive Director. Now you do such great work. Thank you for the work that you do. You are just crushing it. And I just so appreciate you and everything you do. I aspire to be like you when I grow up. I just so thank you.
Shucks. You know, it's the Sabres. The Sabres are just
it's
out
the Sabres,
there, you know,
yes. It's under
doing what we do. Right. Thanks, everybody. We'll see you on next Monday.